Here is the slide of palatine tonsil. How do we say that this is palatine tonsil? The characteristic feature is presence of a tonsillar crypt which is flanked on either side by lymphatic nodules and mucous glands. The crypt itself being lined by stratified squamous non-keratinized epithelium. No other lymphoid tissue will actually look like this. Now, let's try to describe the structure of palatine tonsil. Palatine tonsil is included under the group of mucosa associated lymphoid tissue or MALT. This is present in the oropharynx in the tonsillar fossa as paired almond shaped masses. Why do we call palatine tonsil as an organ but not a typical mucosa associated lymphoid tissue? Remember, only one part of the palatine tonsil is covered by capsule, so we still include it under the classification of the organ. So this is a secondary lymphoid organ located in the tonsillar fossa of the oropharynx. How do we describe the structure? This is the view under 10x magnification. If we just scroll through the entire slide, one side of the entire palatine tonsil is covered by capsule, as we can see. This is present towards the cheek side or the lateral surface. Whereas if we come towards the oral surface or the medial surface, we have the lining epithelium of the oral cavity, that is the stratified squamous non-keratinized epithelium, which invaginates into the substance of the palatine tonsil. The largest of such invaginations is called as the major tonsillar crypt. Now, these crypts on either side are flanked by lymphatic nodules. These lymphatic nodules can again be primary or secondary. So, palatine tonsils act as a part of the Waldear's ring formed by the palatine tonsils, the lingual tonsils anteriorly, the nasopharyngeal tonsils posteriorly, and the tubal tonsils which are located in the nasopharynx. Right? So this also forms a line of defense for the pathogens entering through the oral cavity. Apart from this, the other feature that we must identify here is close to 3 o'clock position, we can identify mucous glands associated with these palatine tonsillar crypts. Most of these do not open into the base of the crypt. Some of them occasionally open into base of the tonsillar crypts. This is how we describe the structure of palatine tonsil. If you are getting the slide of palatine tonsil for discussion, apart from the comparison between the palatine tonsil with the other 3 lymphoid slides, you will be asked about its embryology. Remember, palatine tonsil is a derivative of the endoderm of the second pharyngeal pouch. This will be asked in your histology discussion, so remember it. Possibly they will also ask about derivatives of the first, third and the fourth pharyngeal pouch. So you need to remember this, and once we discuss the slide of the thymus, we will again revisit this discussion. So how do we differentiate this from the lymph node? Even though lymph node will also have lymphatic nodules, it has capsule which is made up of connective tissue, but here the lining epithelium, that is stratified squamous non-keratinized epithelium with the crypt, will be focused always. Right? Then we differentiate this from the slide of spleen because spleen has characteristic red pulp and white pulp, and the white pulp contains lymphatic nodules with central arteriole. This is not thymus because we don't see thymic lobules with Hassel's corpuscles in the medulla. Right? So this is how you should describe the structure of palatine tonsil.